Okay, moving on. Now UK MHRA, which is the regulatory body for United Kingdom. United Kingdom, the adverse event reporting form of United Kingdom is called as yellow card. Very very famous, very famous interview question of pharmacovigilance. What is the adverse event reporting form of UK MHRA called as? So the answer would be yellow card. Why is it called as yellow card? Because इसका रंग, इसका color yellow होता है. That's all. Because of the color of that reporting form, we call it as yellow card. Yellow card was established in 1964. Very very important set of information for you all. Just try to remember this. Then serious valid ICSR and non-serious valid ICSR. Serious valid ICSR 15 calendar days and 90 calendar days, same as EMA. What we saw in EMA, see, 15 calendar days and 90 calendar days for serious and non-serious respectively. Similar pattern would be followed by UK as well, MHRA as well, 15 and 90 calendar days. Just remember this. Again, brief information about yellow card. Yellow card is, who can report adverse events. In yellow card, both patients and healthcare professionals are encouraged, and MHRA provides yellow card to patients with information on reporting of the adverse events. So this is the yellow card. What is yellow card? Yellow card is basically a form. जैसे हम बैंक में जाते हैं, we want to open, let us say, a fixed deposit. So that bank person will tell you that, okay, take that FD ka form and fill that. So that form will have every single information about your Aadhaar number, your the amount of money for which you need to you have to open the FD. All the things should be properly documented in that form. Similarly, if you want to document a particular adverse event, then yellow card एक form होता है, वो आपको fill करना होता है. So just a small glimpse about this yellow form. See, patient details you have to fill. Patient initials है, उसका sex है. Is the patient pregnant? If the gender of the patient is female, then whether the female was pregnant or not when the adverse event occurred. So you have to mention that. Ethnicity, age, weight, the suspected drug, कि यहाँ पे हमने जो भी ड्रग दिया था वो उसका बैच नंबर, the route of administration, whether it was given orally or intranasally or rectally, vaginally, all the relevant information. Then we have the dosage, कब start किया था, कब stop किया था, and for what it was prescribed, the indication of that particular drug. Then we have the information about the suspected reaction. जो भी adverse event हुआ उसकी info यहाँ पे हम mention करेंगे. And there is a small little box here, outcome of the event, कि वो event हुआ but क्या वो recover हुआ. Suppose a patient reported vomiting has occurred, but has the vomiting recovered, or is it continuing? Is it still continuing? So just check accordingly. है ना, ये patient ही करेगा या physician करेगा, whoever is reporting that adverse event, he will do that.